You sent over some really eye-opening research on poverty and mental health here in the UK, and honestly, this is something we need to really dig into.
Yeah, it seems like you found some sources that really get to the heart of the issue, going beyond just the numbers and looking at the human impact.
Exactly. And
Yeah.
a good place to start is with how we even define poverty. I mean, it's easy to get caught up in just the financial aspect, right?
Yeah.
But this research, it kind of pushes us to think bigger.
Absolutely. What's really striking is how much our understanding of poverty has evolved. It's no longer just about income levels, it's about access to education, to healthcare. Heck, even just feeling included in society. There's one study in here that found children living in poverty are something like 60% more likely to experience developmental delays. I mean, that really hits home how much more there is to it than just money.
Wow, 60%, that's huge. It's like, just imagine being a kid and feeling like you're falling behind, not because of something you did, but because of the environment you're growing up in. That's got to have a huge impact on mental health.
Right, and that's where this broader definition of poverty becomes so important, because it helps us understand the psychological stressors that are so often linked to it, things like, well, chronic stress, for example, which comes up again and again in this research.
Yeah, I mean, that makes sense, right? If you're constantly worried about paying bills or where your next meal is coming from, that's going to take a toll. But it seems like it goes even deeper than just those everyday worries.
Exactly. It's the relentlessness of it all, that constant pressure that really wears you down over time. And then on top of that, you often have things like social isolation, not being able to afford to go out with friends or just having different life experiences that make it harder to connect with people. It's like all these factors come together and create this perfect storm for mental health challenges.
And this is where it gets really interesting because the research you sent, it doesn't just lay out the problem. There are some pretty stark statistics in here about the UK specifically.
Yeah, and those numbers, they're hard to ignore. For example, the Department for Work and Pensions here in the UK, they found that adults in the poorest households are more than twice as likely to experience mental health issues compared to those in the wealthiest households. It's like 20% versus 8%.
Wow. Okay, so just based on your economic circumstances, you're more than twice as likely to struggle with your mental health. That's disturbing is really the only word for it. But I'm curious, before we get into the why, what kinds of mental health challenges are we mainly talking about here?
Well, the research points to a strong link between poverty and a higher risk of experiencing anxiety and depression. There's one study from the Mental Health Policy Group that really highlights this direct connection between economic hardship and these conditions becoming more prevalent. And it's not just about how common they are, but also, how severe and how long they can last for people living in poverty.
So it's not just a matter of, oh, things are tough right now.
Yeah.
It can really become this chronic issue that traps people in this cycle of poverty and poor mental health. Right?
Exactly. The Institute for Fiscal Studies, they found that when people experiencing poverty do have mental health issues, those issues tend to be more persistent, harder to overcome, which obviously makes it that much more difficult to improve their situation.
It's heartbreaking, really. And this is where I think the human element becomes so important because we can talk about statistics all day, but behind those numbers, we're talking about real people's lives.
Right, and you've highlighted some really impactful case studies that drive that point home. One that stuck with me was about a young mother in Manchester who was really struggling to make ends meet as a single parent. And just that constant financial strain combined with like a lack of support, it just pushed her into this really dark place with anxiety and depression.
It's like that saying, it takes a village. But what happens when the village itself is struggling?
And I'm curious, did the research touch upon any specific groups within the UK that might be particularly vulnerable in this situation?
Yeah, definitely. Children are mentioned quite a bit, actually. I mean, it makes sense when you think about it.
Yeah.
Growing up in poverty, it can really impact their development, both cognitively and emotionally. There's one study that found that kids in poverty, they're more likely to have to deal with chronic stress, and that can actually, like, mess with their brain development, making it harder for them to learn and succeed later in life.
It's like this domino effect almost. And it's not just kids, is it? I feel like there were a couple of other groups that were highlighted as facing kind of unique challenges in this situation. You're right. Older adults, for example, they often face a whole other set of challenges, right? Social isolation, declining health, and then you add financial strain on top of all that, and it creates this really high risk for mental health issues. A lot of seniors are living on fixed incomes, which, with the cost of everything going up, can make it almost impossible to make ends meet. It often comes down to choosing between basic necessities and their own well-being.
It's like they're being squeezed from all sides, really. And I
Oh,
can
yeah.
only imagine it's even more complex for minority communities in the UK.
Oh, absolutely. The research you sent, it touches on how systemic barriers and discrimination just make everything worse, both for poverty and for mental health. For example, there's a lot of research showing that ethnic minority groups here in the UK, they're way more likely to live in areas with less access to essential services, and that includes mental health care. And then, of course, you've got the added layer of racism and social exclusion, which obviously takes a huge toll on people's mental well-being.
It's just layer upon layer of challenges. It's pretty bleak, to be honest.
Yeah.
But knowing all of this, I can't imagine it's easy for people to actually get help when they need it most.
Sadly, you're right. Accessing mental health services is a huge hurdle for people living in poverty. Cost is a big one, obviously. I mean, therapy, even just getting to appointments, it can be really expensive. There was actually a quote in here from someone who said they often had to choose between going to therapy and paying their rent. I mean, that's just wrong.
It's an impossible choice.
Yeah.
And even if cost wasn't a factor, wouldn't there still be the issue of just not having enough mental health professionals, especially in lower income areas?
Oh, definitely. There's a real lack of resources in those communities, which often means long wait times for appointments, limited options for specialized care. It can even be tough to find therapists who are culturally competent and really understand the unique challenges that people from these communities are facing.
So you've got the financial barrier, the lack of access. Are there other, maybe less obvious things at play here? Something that might prevent people from seeking help, even if those other factors weren't an issue?
There's one big one, stigma. There's still so much stigma around both poverty and mental health, and it prevents a lot of people from reaching out for support. They worry about being judged, being discriminated against, or even just having their experiences brushed off as not a big deal.
Which, when you think about all the negative stereotypes and judgments that already surround poverty, it's completely understandable that people would feel that way. It's like they start to internalize those messages and blame themselves for their circumstances. So, did the research offer any solutions for breaking down these barriers?
It did, actually, and there's definitely a sense of hope. A lot of the research pointed to some really innovative approaches that are coming from within communities. One that really stood out to me was the idea of peer support groups. It's basically creating a safe space for people with lived experience, both with poverty and mental health challenges, to connect and support each other.
It's like that power of shared experience, right?
Yeah.
Sometimes the people who get it the most are the ones who've been there themselves.
Exactly.
Yeah.
There's just something really powerful about being in a room with people who understand what you're going through without judgment. And it's not just about emotional support either. These groups, they can offer practical advice, share resources, even advocate for each other's needs.
Right, so it becomes less about individual resilience and more about empowering the entire community. Were there any other community-based solutions mentioned in the research that seem to be working well? It's like we're talking about a total shift in perspective, right? Moving away from this idea that help comes from the top down, and instead really meeting people where they are.
Yeah, exactly. And there are programs out there doing just that, like these community outreach initiatives that are bringing mental health services directly to those who need them. Setting up shop in low-income neighborhoods, schools, even homeless shelters. It's all about making it easier to get help on your own terms without those added barriers.
I love that, just making it more accessible and proactive. It's such a different approach than having to navigate the often confusing world of traditional mental health services.
And it's not just about access either. It's also about making sure those services are actually relevant and helpful. Like one of the articles you sent, it talked about training healthcare providers to be more culturally sensitive, recognizing that what works for one person might not work for another. We can't just have this one-size-fits-all approach.
It's that whole idea of breaking down silos, right? Poverty, mental health, they don't exist in a bubble. They're impacted by everything around them. Social determinants, systemic issues, all of it. It's complex.
Absolutely. And that's why I think these community-based solutions are so powerful. Because they're not just putting a Band-Aid on the problem, they're trying to address those root causes,
Right.
create a better environment for everyone.
This has been such a thought-provoking deep dive. I mean, we started with what seemed like a simple question: what's the link between poverty and mental health? And it just opened up this whole conversation about social justice, economic inequality, the very fabric of our communities.
It is a lot to unpack, isn't it? But honestly, what I found most hopeful in all this research you sent, it's that sense of agency. Like, we don't have to just accept this as reality. There are things we can do, and often the most effective solutions, they come from within the communities themselves.
100%. So to anyone listening, if this conversation has sparked something in you, don't let that go.
Yeah.
Do something with it. Educate yourself. Support those organizations doing the work on the ground. Even just volunteering your time or donating what you can, every little bit helps.
Because at the end of the day, this isn't about research or statistics. It's about people's lives. It's about creating a world where everyone has the chance to thrive, no matter their income.
Couldn't have said it better myself. Until next time, everyone, keep asking those tough questions and diving deep.